The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the first surgical clinic of the General University Hospital. Bed making is an integral and important part of nursing care. Having a clean, dry, and well-made bed can prevent various nursing complications, such as the formation of pressure sores, and it creates an aesthetically pleasing environment for the patient. We adjust the bed every day, usually during the patient's morning hygiene routine, and also before they go to sleep. We check the condition of the bed throughout the day. We change the bed linens as needed. After a surgical or diagnostic procedure, we place the patient in a clean bed. Equipment. Clean bed linen, the patient's nightgown, a one-time use pad, and a cloth pad for comfort, sheet, pillowcase, and pillow. We use protective work equipment, working gloves, and wear a plastic apron. We change the apron between individual patients. If necessary, we add a face mask and head covering. The height of the bed is adjusted to maintain ergonomics and avoid unnecessary strain on our spine. Bed adjustment with the patient along the length. This is done for patients who cannot be seated, or like after surgeries or back injuries. The individual parts of the linen are changed as needed. When making the bed, we always start at the head, keeping clean bedding on the cot, and we put the pillow and blanket on a chair or a small side table. Dirty linen is never placed on the floor, but is thrown into designated bags. We turn the patient on their side and change the base of the bed. At the corners of the sheet we make knots, to ensure it is tight without folds, and roll it behind the patient. We place a waterproof underlay on the sheet, ensuring it never touches the patient's skin directly. We cover it with a cloth pad, known as a positioning pad. Once more, we check that the linens are perfectly tight. Throughout the bed-making process and while handling the patient, we maintain verbal communication and monitor the patient's physiological functions. Using side panels helps to lower the risk of a fall. We ask the patient for cooperation and ask them to turn onto the other side. Used contaminated pads are discarded in infectious waste. The linen is placed in the designated bags. We untie the knots on the used sheet. We perfectly stretch the clean sheet. We perform the same procedure with the other linens. making the bed with the patient lying on their side. This is used for patients who cannot be turned to their side. We proceed from the head to the torso and then the lower limbs. The patient is first seated. We loosen the base of the bed and roll the bed linens, which are replaced with clean ones. After that, the patient lies back and raises their hips and legs. The sheet and pad must be perfectly stretched. Overview. We handle used linen as little as possible and treat it as infectious material. During bed making, we monitor the overall condition of the patient. We maintain verbal communication and check the pressure points. Bed linens and used linen are never placed on the floor. We ensure the bed is clean and the sheet with the pad under the patient is sufficiently stretched to prevent skin pressure sores. We monitor the work of lower healthcare staff and pay attention to ergonomic practices.